Do you know what pressure injuries are? Pressure injuries, also known as pressure ulcers or bedsores, are a serious problem that can cause harm to you or your loved ones. They are wounds on the skin that often develop over the bony areas of the body from lying or sitting down in the same position for long periods. Pressure injuries can cause pain, increased risk of infection, and can also lead to long-term disability or even death. They can take months or even years to heal, and as they worsen, they can become harder to treat. If you or your loved one is chair or bed-bound, there is a high risk of developing a pressure injury. There are 6 simple steps you can follow to help you prevent and manage pressure injuries. Think injury. I stands for Incontinence Care. Constant exposure of the skin to moisture from urine or feces can cause skin damage and increase the risk of pressure injuries. To prevent skin breakdown, it is important to ensure good personal hygiene. Cleanse skin with water or pH balanced cleanser and dry skin gently and thoroughly after each episode of incontinence. You may also ask your healthcare professional about suitable products such as barrier creams or sprays to protect the skin and suitable lotions or moisturizers for dry skin. N stands for nutrition and hydration. Eating a wide variety of food in moderation and in the right balance provides the nutrients required to maintain healthy skin. If you or your loved one is at risk for developing a pressure injury or has an existing pressure injury, it is important to have enough protein, vitamin C, and zinc in your diet. In addition to fluid from your food, it is recommended to drink 6 to 8 glasses of fluids a day, unless instructed otherwise by a healthcare professional. Being overweight, underweight, or having diabetes also increases the risk of developing a pressure injury and may slow down healing of an existing pressure injury. Speak to a healthcare professional for more advice on diet, weight management, or diabetes control. J stands for 𝗓ust Move. Moving regularly is important to prevent pressure injuries. If you or your loved one is bed-bound, turning should be done at least 2 hourly, changing positions between the left side, right side, and lying flat. If chair-bound, change positions at least 3 times per hour while seated. Examples of such position changes include leaning forward and back, leaning to the sides, lifting the buttock of the chair by pushing upwards, and lifting the feet off the footrest regularly. U stands for use pressure relieving surfaces. There are many types of mattresses, cushions, and aids that are designed to reduce pressure on the skin. If you or your loved one sits or lies still for long periods, discuss with your healthcare professional about products suitable for your needs. R stands for reassess skin regularly. Checking the skin often will help you detect and treat pressure injuries early and avoid complications. Check skin for unhealthy changes in color that does not go away, such as red, purple, blue, or black skin. Changes in skin texture, such as dry patches, swelling, blisters, or breaks in the skin. Changes in skin temperature, such as warmer or cooler areas of skin. Y stands for you should seek help early. If you notice any skin changes, inform a healthcare professional early. Once a pressure injury worsens, it can become harder to treat and can lead to complications. So remember injury, incontinence care, nutrition and hydration, 𝗓ust Move, use pressure relieving surfaces, reassess skin regularly, and you should seek help early. Having a pressure injury can significantly impact both the life of a patient and their caregiver. To help us better understand this, we have with us a caregiver, Madam Tang, to share her personal experience. Hi Madam Tang, can you share with us what was it like being a caregiver to your mother who suffered from multiple pressure injuries?
It was a very tough and long journey. As my mom has problem moving around, as a result, she has developed pressure ulcers on her lower back and her lower leg. It was not easy to care for my mom, especially with the added burdens of the pressure injuries that take many months to heal. To prevent the wounds from worsening, my helper and myself have to frequently turn my mom when she was lying down on the bed. When she was sitting, we have to regularly lift her up. Although she was not big size, but you also take a bit of effort to do that.
Indeed, pressure injury needs a lot of effort to manage and treat, and it is not easy for the caregivers. To better help us understand patient perspective, could you share with us how your mother felt during her journey dealing with pressure injuries?
Due to her medical conditions, my mom was not able to talk about her discomfort or pain. So when I changed the dressing for her, I think I could tell that she was uncomfortable. She would sometimes flinch when the old dressing were removed or when the new medications were applied onto the wounds. I imagine it was probably not easy for my mom to deal with the injuries or the discomfort. If I could turn back the time, I think I would definitely do more to prevent her from developing the injuries.
Could you also share with us what helps you as a caregiver to manage your mother's condition?
The advice from the healthcare professional given to me was very useful for me to manage my mom's condition. I also appreciated their willingness to help me throughout the journey as and when I needed more advice.
Thanks for openly sharing your personal experience, Madam Tang. Would you have any advice for other caregivers?
I would encourage the caregivers to learn more about the pressure injuries and how to prevent them, especially for those with loved ones at high risk of developing pressure injuries. As the saying goes, prevention is better than cure. It is important to make an effort to learn how to prevent pressure injuries and to seek help early if you discover any skin changes.
Yes, the majority of pressure injury can be prevented and the complications can be avoided by seeking help early. We can all do our part to prevent pressure injury from happening to ourselves and to our loved ones.